Okay, well, welcome everybody to our November Healthy Aging 101 webinar. This is a monthly webinar series that's produced by Sinai Health's Healthy Aging and Geriatrics program in partnership with UHN, the National Institute on Aging, and this particular month, TELUS Health, which is helping to sponsor this month's Healthy Aging 101 because it's actually Falls Prevention Month. And so we thought it would be a great time to talk about this topic of practical technologies that can enable aging in place, because certainly we're hearing a lot about technologies, but how do you kind of make your way through, and how could they actually help us maintain our independence? That's the focus of today's talk. And so again, my name is Dr. Samir Sinha. I'm the Director of Geriatrics at Sinai Health and University Health Network. I'm also the Director of Health Policy Research at the National Institute on Aging, and I'm a professor of medicine in the departments of medicine, health policy management evaluation, family and community medicine at University of Toronto, Ryerson, and at Johns Hopkins. So welcome, and looking forward to sharing with you a presentation. And then we're also going to have plenty of time for questions. So if any of you have questions during the webinar today, you can certainly ask them in the Q&A button. So at the bottom of your screen, you'll see the Q&A button where you can ask questions that way. And so you can start putting them in anytime throughout the talk. And then if you have any technical questions or technical issues, you can please put them in the chat function, and one of my colleagues will help to answer that as well. So without further ado, we'll get underway, and happy to have everybody watching from near and far for today's presentation. So why are we here today? So older Canadians, more so than ever before, want to maintain their independence as they age and to live at home for as long as possible. We have known this for a long time, but I think the pandemic has really created an increased resolve for people who want to stay in their own homes, in their own communities, and avoid residential care settings whenever possible. And we know, though, that with increasing age comes a growing risk of issues like falls and for other medical or health emergencies that can occur at home that can often threaten one's long-term health and or independence. So these are that tension. People want to stay in their own homes for as long as possible, but they realize that there is also this growing concern about how do I do so in a way where I can feel safe and secure in doing so. And so we know that older adults and their families are open to receiving advice on how to age well in their own homes, but generally are not asking for that advice from their primary or other regular care providers. So the question is, if people are open to this information, but they're not necessarily able to get it or open to asking for it from their regular care providers, well, where are they getting this information from, and how do we help them access that information? That was part of the motivation of creating this presentation, to help give you some of the insights that I've learned in terms of providing support and advice to my patients and their families. And we know that most healthcare providers as well are not really aware of the rapidly evolving technology solutions and what to consider recommending that can better enable their patients and their families to age in place. So certainly I can tell you that my patients and their families are often educating me. My colleagues who are social workers or community occupational therapists are often educating me about what new developments are out there. So again, this is my opportunity to share with you what I've learned from my colleagues and my patients over time. So our three overall objectives are really going to be to understand the risks and impacts of at-home medical emergencies. We're going to appreciate why older Canadians want to age in place more than ever before. And then three, we're really going to understand the practical technologies that can enable aging in place, really the title of today's presentation. So first of all, let's understand some of the risks and impacts of at-home medical emergencies, because while we all like to think about aging in place for as long as possible, for example, we sometimes don't like to think about some of the things that could potentially happen that often are sometimes difficult to think about, and maybe some things we don't really want to focus on. So the number one issue that we always have to think about are falls, because falls are the leading cause of injury in Canada for older adults. And just to put this into perspective, we have millions and millions of older adults, but we know 1 in 3 community dwelling older adults will fall in a given year. And if you're an older person, for example, living in a retirement home or a nursing home, for example, you have a much greater risk of falling. About 1 in 2 older adults in these settings will actually fall in a given year. And that's partly related to the fact that people who tend to live in retirement or long-term care homes tend to have more physical and cognitive limitations, things that will increase their risk of falling. But it's not to say that people living out in the community aren't also at risk. But 1 in 3 older people will fall in a given year if they're living in the community. And just to get a sense of how significant this ends up being, we know that with 1/3 of older Canadians falling in a given year, some will actually end up having injuries that result in about $2.3 billion in annual costs related to falls alone. So this is a huge public health issue. It's something that our Public Health Agency of Canada and others have been looking at over time. But we also know that the number one fear that older Canadians actually have is actually a fear of falling. So it is actually known as a phobia, a fear, and it's actually a reasonable fear to have because it can happen, and they certainly can have negative consequences. So it's good to get this out on the table because it's something that happens often, something we often don't talk about. But again, it's a leading reason why people might lose their independence and not be able to remain at home for as long as possible. So let's understand some of the risk factors behind falling, because again, we can say, well, it's very common, so isn't it an inevitable part of aging? It isn't an inevitable part of aging. And there's often a lot of practical things we can do to prevent falls in the first place. So we have to recognize that first and foremost, age is actually a really common risk factor because these are the leading causes of injury-related hospitalizations amongst Canadians 65 and older. And we know that as we get older, for example, it's not uncommon to experience various increasing health conditions, challenges with our gait and balance, for example, challenge with our vision, challenges with our hearing, other things that can all add up to increasing risks associated with age that can actually increase our risk of falling. So what are some of those areas? Well, visual and hearing impairments are really common amongst older adults. We know that 25% of older Canadians have visual impairments or have hearing impairments, for example, that are serious enough that they need to actually be addressed by a healthcare professional. So things like cataracts or glaucoma, for example, or hearing impairments that might require the benefit of a hearing aid or a hearing amplifier. And the key is that people often don't think about this, but in order to stay balanced, in order to stay steady and on our feet, we often need to maximize our senses. So if you think about your senses about touch, and that's what you get when you're actually standing up and your feet are on the ground, for example. That's actually providing you with some sensory input through your feet that actually help you to balance yourself. But the other things that help you maintain your balance are your hearing, but also your vision as well. And when those are negatively affected, that can all impact your balance. So that's why it's really important that if you actually have vision or hearing issues, sometimes people don't really care about dealing with them, but if they're more concerned about falls or other issues, then they might be more motivated to address them. But these are significant common causes of falls, are untreated visual and hearing impairments. I mentioned that other health conditions can be more common as we age. So for example, we're more likely to be living with cardiovascular respiratory diseases as we get older. Some people might have more long-term consequences of diabetes as they get older, because sometimes it takes years to manifest some of those issues, like what we call peripheral neuropathy or a lack of sensation in our hands or feet, for example. We know that if people have a level of obesity, that could actually affect their balance. It could actually affect their joints as well. Cardiovascular respiratory illnesses can affect our ability to breathe well and our exercise tolerance. So it may make us actually more fatigued when we get around and maybe a bit more unsteady. we know that as we age, we have an increased risk of developing a dementia. And dementia basically is how our body interprets what we see and how we interact with the world, which can also affect our brain's ability to actually see and sense things properly, and also affect our ability for our muscles and our joints to move properly. And that's where dementia can actually be a significant reason why we're at increased risk of falling. But also, if someone has an acute illness, for example, you're really not feeling well, you're more fatigued, that can take the wind out of you, if you will, and make you at increased risk of having a gait or balance issue. And then a lack of exercise. You've all heard that line, move it or lose it. And when we don't actually stay active, our muscles can atrophy. And those muscles are really important things that actually help us do things like getting out from to a standing position from sitting in a chair. So all these are things that can actually accumulate as we age, and this is why we see falls happening so much more commonly as we age and in our older populations. But then we also think about, these are some of the things that I've just talked about that are what we call intrinsic factors, so things that are intrinsic to who we are and our health status. But then there can also be external factors as well. So if we have a lot of clutter in our homes or tripping hazards, things like loose rugs, for example, if we have poor lighting so you can't really see how you're navigating around your house or outside, if you have balance issues and, for example, you're not really interested in using gait aids like a cane or a walker, for example, that might help you maintain your balance, for example. If you're using several medications that, for example, can affect your balance or your gait, for example, some of these sorts of things, for example, all together can be what we call external or extrinsic factors. Poor fitting shoes, for example, uneven pavement. Or you can think about a myriad of other things that externally can actually make you less steady or cause you to trip and actually fall. So these are all the things that we think about, because whenever we have an older person who reports that they've fallen, for example, we know that they're at a significantly increased risk of falling again in the future. So I ask all of my patients, have you fallen one or more times in the last 6 months? That's the only question I need to ask. And if they say, yes, I have, I know that they're at significantly increased risk of having another fall in the upcoming 6 months, for example. So this is where then I start reviewing all these sorts of factors to see, are there things that we can modify here or improve to help reduce the risk of falling? So it's important to understand falls, because falls are one of the greatest reasons why our independence at home can be threatened, for example. So as I mentioned, 1 in 3 Canadians, older Canadians, will fall each year. And 1 in 3 of those falls can result in serious injuries. So for example, you can think that you might fracture your wrist, or you might actually hit your head and have a concussion or other things. These are what we talk about when we talk about serious injuries. Many people fall and they say, oh, I fell and I got up and I was okay, and thank goodness I didn't break a hip. But 1 in 3 people who fall will have a serious injury, and those serious injuries tend to lead people to come to hospital. And when people actually come to hospital, we know that 4 in 5 of the hospitalizations due to any sorts of injuries amongst older persons are because of a fall. So you can see how these things are often interlinked, for example. And when we actually think about the falls that are treated in hospital, for example, 4 in 10 of them actually are involving the treatment of fractured hips, for example. So you can imagine there are other fractures beyond that 4 in 10, people fracturing their arm or other things where they might not need to stay in hospital. But you can see that, again, when 1 in 3 falls results in a serious injury, and that injury can actually lead to one being in hospital, you can see that the biggest thing that we're always worried about is people fracturing a hip, because that can significantly reduce a person's overall life expectancy, but also their ability to return home and return back to the same level of physical functioning they were before. So again, this is why we're so concerned about falls, and why you can imagine that the falls related expenses across Canada are about $2.2 or $2.3 billion a year in healthcare related expenses. We also know that when we talk about where falls occur, 50% of falls occur at home, and then most of the falls that occur in general occur either in the home or in the near vicinity of the home. So people getting outside, maybe in their garden or going for a walk, and other things. So we know that there's often lots of things we can do around people's homes that we can do to support them from falling as well. And so I think it's really important to think about this because, again, as more and more of us are aging, what are the things we can do to support people to age well and independent at home, and make sure that doesn't include falling as well. So we think about falls as the number one kind of issue that can actually happen in a person's home or near someone's home, and then a major reason why people will end up in hospital. But we also have to think about other potential emergencies that can happen around one's home, for example, and things that we need to be mindful of. So one of the things that we think about are medical emergencies. So again, there's that risk that as we age, for example, there's an increased risk that we could experience a stroke, a heart attack, trouble breathing, a severe allergic reaction, and especially and other things when we may be unable to actually call 911, for example. So these are things that can actually happen, and we have to be mindful about, are these things that we're at increased risk of experiencing when it comes to a medical emergency. We also know that there are consequences that can happen related to memory impairments like dementia, for example. So this might lead to injuries when taking on daily tasks, for example. So we talked about how dementia can increase one's risk of falling, for example. It can also lead us to sometimes forget to use gait aids or other tools. Sometimes I have patients, for example, who burnt themselves when they're trying to cook. They forget to, they're not so handy now around the stove, or when doing certain tasks that could be dangerous and therefore need a sharp mind. And then there's also the other risks of wandering, for example, that can increase, for example, as well. And so these are things where, again, how do people call for help or action for help if they have these issues at play as well. We also know that, as you said, sometimes people can experience sprains or strains, for example, to arthritic or weakened joints. And this can sometimes lead to injuries that can limit one's independence. So maybe it's not a fracture, for example, but there can be other things that can happen, especially if someone has other joint-related issues, for example, related to mobility. And then I think if anybody's been paying attention to what's been unfortunately happening in British Columbia just over the past few days, for example, we can get a real good sense of the issue of natural disasters and other emergencies. So imagine power outages, heat waves, winter storms, flooding, home fires, all those sorts of things that can actually happen that can, again, put us potentially at risk either in our own homes or out in our communities as well. So these are things that, again, we often don't really think about. We do a pretty poor job as a society being ready for disaster or emergency preparedness. And for older people especially, we know that older people tend to bear the brunt of these issues. When it comes to natural disasters or emergencies, it's older people who tend to actually be the greater victims of these issues and a higher risk of dying. And so again, what are the things we can do to support people in medical emergencies or other emergencies that can actually happen that aren't even medical in nature, but are things that can threaten our health and wellness and independence? So understanding that context, then we can appreciate as well, why are older Canadians wanting to age in place now more than ever before? Well, we know that when we've done some recent work through the National Institute on Aging, we did a study in partnership with TELUS Health a year ago, after the first, towards the end of the first wave of the pandemic, for example, and we did a subsequent study with the Canadian Medical Association, where again, we surveyed thousands of Canadians of all ages to actually ask them, what, what are their thoughts around aging in place and where they want to age. And basically, the data always comes through that nearly 100% of older Canadians being surveyed say they plan to live independently in their own homes for as long as possible. And in fact, again, that people often say that they will do everything possible to stay in their own homes for as long as possible. And we know that during the pandemic, we've seen about 60 to 70% of Canadians in general, and older Canadians in particular, who said that they've actually reconsidered whether they'd ever want to leave their homes and move into a long-term care retirement home. So people are more committed than ever before to stay and to age in place, but they want to do it as safely as possible. But then when we ask people, 30% say they don't feel prepared should they be alone when a medical emergency occurs in their own homes. And it could be a medical emergency, or it could even be another emergency. How prepared are people, for what to do in a situation like that? And of course, some people will say, well, hey, if I have a stroke, I have a stroke. Like, what else could I do, for example? Well, hopefully I'll be awake and I can call 911 or I can do something. But again, I don't think a lot of people have always thought through, well, what would you do in that situation? What could be that circumstance? What would you do if you were alone? How would you manage that? And I think this is that gap that often people are not really sure what to do, and they just kind of hope that it won't happen. But I think it's important to have these conversations and think it through so that people can figure out what would work best for them. And right now, again, is one of the things that we said is that when we ask people, 79% said they haven't spoken to their own healthcare professional about what to do if a fall occurs to themselves or a loved one. But as I mentioned before, a lot of healthcare professionals say that they're really not sure what to actually suggest to their own patients. Should they ask about, well, what would I do, if I had an emergency? So it's kind of this thing where a lot of folks are concerned about this, but they're not really talking to their healthcare professionals, but their healthcare professionals aren't necessarily talking to them because nobody really has the right information to relay. And this is why often I rely on my patients and their families to tell me what they're up to. But I also rely on my colleagues, such as my social work or occupational therapy or physiotherapy colleagues, who've actually taught me a lot of things as a geriatrician on what are things that people can do to age with greater confidence in that way as well. So as I mentioned before, as healthcare professionals, we can often provide older Canadians and their families with the right tools and the right information to help everyone age in place with greater confidence. And I think it's really important to look at this information because we need to make sure that we can better provide this information and support as people need. And right now, we know that 83% of Canadians who are 55 and older say they're open to receiving advice on how to live safely in their own homes. And that's why I think over 800 people registered to be a part of today's webinar as well. So on with that. So let's get to the main event then, right? I think I've beat this with a dead horse, in that way, if you know that expression, where I think I built the case as to why we should be talking about this, and what is the right advice that we can give as well. Okay, so point 3 was basically understanding the practical technologies that can enable aging in place. This is, I think, what people signed up to really learn about. So here's what I know, and here's what I can provide advice around, for example. So often people actually think, about, really, really fancy gizmos. They think about robots or other things, but often there's a lot of things that we now actually have at our fingertips, if you will, or that are actually readily available that I think it's always important for people to think about, for example. So the first thing I think about is a smartphone. So for example, if you have, a smartphone, and most older people do now, a growing number of older people do, then all of a sudden you realize there's often a lot of things you can do. For example, you can imagine if you had the old corded phones, for example, or you didn't have the portable piece that you could kind of keep in a house coat, or you could keep on, kind of your walker or other things, or on your person, people would feel really less reluctant about wandering out into their own community, for example, or even wandering around the house and getting around, because they felt that they were, you can't really be mobile. So, people call them smartphones. The other term is a mobile phone, because even that alone can give people a sense of security, so that I can go and get out easily, and I can easily call people whether there's an emergency or not. So that can be a very simple device and an opportunity. And for example, if you actually have an Apple phone, for example, and I'm sure maybe the Android phones might have this as well, they even have false detection technology in them. So they can actually organize themselves to actually call or to indicate, sorry, not the smartphones, that's the different thing, a smartwatch, but I will talk about that in a second. But anyway, smartphones can be easy ways that people can look around. And often there's lots of apps that are now actually coming out on various smartphones. You can have smartphone apps, for example, that you can use to kind of keep track of your paces and other aspects. You can track your health information. All these can be important things that can be very helpful to help people to age in place that way. Often, with a smartphone, if you have one of those, then you can actually have a window into using virtual care. And so during the past, 18 months, for example, I think a lot of people have now become very familiar with this idea of virtual care, communicating with your doctor or another healthcare professional, where they might send you a video link through which you can actually communicate with them, either sometimes through FaceTime, sometimes through Zoom, sometimes through, if you're in Ontario, the Ontario Telemedicine Network, where literally you can actually get a link. You just click on that link and you can see your healthcare provider that way. Again, a smartphone can be a useful tool that you can use to actually provide yourself virtual care, and again, allow people to be better connected. And I know for a lot of my patients, for example, who are homebound or who cannot actually come and easily see me, by having access to virtual care, by using a smartphone or an iPad or other devices, for example, it made it a lot easier for them not to have to travel to and from to see me, but it could actually allow me to get a visual. Instead of just talking to them on the phone, it could actually give me a visual of how they were looking, or they could show me a rash or show me something else that was bothering them as well. There's also this notion of remote health monitoring as well. So again, sometimes folks have devices or other things that can be connected to their smartphone, for example, or there are often other devices that people can actually wear. If you're part of a telehome care or a telehealth initiative, for example, you'll sometimes get various devices that can allow you to take your blood pressure, take your heart rate, take your weight, do those sorts of things. And so there are great programs for people that might exist in your community. If you have congestive heart failure, COPD, things where you can actually take your measurements, if you will, on a daily basis, or when you're not feeling well, that information gets transmitted in some cases to a paramedic, or it might be transmitted to a telehealth nurse, for example. And then with that information, they can keep an eye on how you're doing and give you a call and see if there's anything they can do before things really get out of control as well. So a lot of these sorts of technologies exist now, and sometimes can be enabled by smartphones, for example, but sometimes other technology or devices that might be introduced to you that can also allow one to actually more safely age in place, or have that peace of mind and that comfort as well. And so one of the things that I helped to work on over a year ago, for people who sometimes say, Dr. Sinha, I can't afford a smartphone, like I'm on a fixed income, what can I actually do? Well, one of the initiatives I'm really proud about is TELUS actually created a program called TELUS Mobility for Good. And it basically gives low-income seniors, so those, for example, who are basically on guaranteed income supplement, old age security. So these are folks who might be only receiving about $19,000 a year, and they don't have much in the way of other savings, for example. So what TELUS has created is a mobility plan for those individuals. You have to demonstrate that you are not a rich senior, but a low-income senior, and then you can get a free refurbished smartphone, and you only pay $25 a month. And then with that, all of a sudden, you get that ability to be mobile and connected like other Canadians as well. So again, this is a great initiative. It's an opportunity that some people can look, but again, it's an initiative that's been supported to try and get more people connected and supported that way. So that might be something that it's good to raise awareness around because it's something that's specifically been done to support low-income seniors so that they can actually get connected. And then, frankly, it's not just about calling people, but you can FaceTime the grandkids and other things as well. So I mentioned before about fitness trackers and smartwatches. So people will see some of these fancy new watches, like there's the Apple Watch, for example. And sometimes, again, these also have apps in them as well. And it's really cool because sometimes these actual watches, for example, can do things like actually take your heart rate. They can actually do EKGs, which basically what we do to see if there's a heart rhythm abnormality or other things like that. But also the Apple Watch, for example, is one of those ones that actually has an automatic falls detection system in it. So literally, if you actually have a fall, it can tell you has a fall, and it will actually offer, it can actually call 911, if you will, on your behalf as well. So it's a pretty cool feature that some of these smartwatches have. And again, it might be something that's, again, of interest to someone who might want something that's a bit more discreet, for example, and practical, because you can use it to make phone calls, you can use it to track your fitness, you can use it to do an EKG. It can also be a potential falls detection solution as well. So just another thing to think about. There are also what we call smart home devices. So now there are other things that are being developed, new technologies, for example, that can actually be, that you can actually bring into your own homes. So for example, there are medication dispensers, for example. So some folks, for example, who have trouble remembering to take their medications, for example, you can actually have a medication dispenser in your own home, for example, that might beep at a certain time when you need to take your medications. And just to make sure that they're taken accurately, it'll only dispense the medications you need to take at that particular time. So sometimes people find that those are devices that can actually be helpful and be useful as well. And one of the things that can actually be linked into a smartwatch, for example, or smartphone, can be what we call GPS detection systems, for example. So sometimes, for example, it can identify your location, especially if you're at risk of wandering or you have a loved one at risk of wandering, then these can be some of these devices as well. And so there are these services called personal emergency response services as well. And so these are where, again, people can get devices, for example. You might get one that's around your wrist, for example, or something that you hang around your neck, or sometimes they're built into to smart watches and those devices. But these are what we call personal emergency response services. I have a slide that can show you kind of some of the different brand names out there that exist, for example. But these are the ones where, for example, if sometimes people think that they're just there for falls detection, for example. So if I've had a fall, it will actually automatically alert the authorities, or you can just give a button a push, for example, and alert the authorities yourself, for example, if you don't have a fall and you're just not feeling well, you can actually tap that button, if you will, or alert family members and friends, or again, the local emergency services, for example. That can be a mechanism as well that one can use. But also these can be developed. There's some of these ones that exist where if people are at risk of wandering as well, it can actually help more easily track where that person has wandered off to as well. So again, lots of different things being developed, but I just want to kind of frame it this way because I think often it's really helpful for people to kind of understand that sometimes there are things that are right in front of us or things that we're quite familiar with that we didn't appreciate how these are things that we can better enable or to work for us to help us to age in place. So a little bit more about personal emergency response services, because sometimes people say, I need a little bit more information. So again, sometimes, for example, As I mentioned, this can be electronic hardware connecting to emergency response centers and dispatch help. So sometimes people say, look, if I have a fall or if I'm not feeling well, I can actually just push a button. Or sometimes if I have a fall and I'm down on the ground, for example, then, sometimes they will actually reach out to you and actually call, and alert. And if you're not responding back, then it'll automatically call for help. And some of these services as well allow you to actually indicate who you would want to be called in an event of an emergency. So for example, it could alert your brother, your sister, your son or your daughter, for example, so that they could be alerted, for example, depending on how you'd want support. So sometimes you might be talking to an individual who basically will tell you, will be able to chat with you, for example, and you can say, look, don't send the ambulance, call my neighbor, they're going to come, over and they can help me out. But in case they're not available, for example, there can be protocols to make sure that you get the help you need. So as I mentioned, these are sometimes typically worn as a pendant, a bracelet, a smartwatch, and you can initiate an alert, or sometimes that alert can be initiated if you've fallen and you're not responding back to when there's two-way communication. And as I mentioned before, there's fall detection, but GPS tracking that's available. And some also allow that two-way voice interaction if a user can't reach a phone. So again, there's lots of different options available. And I think it's always helpful to kind of figure out what are your circumstances, what would make sense to you, and what might actually appeal to you as well. And so when we actually look at some of the literature around this, for example, because I always like to look at, have people actually evaluated these things? How useful are these on their own? Well, we know that a study in the British Medical Journal back in 2008 said that 82% of falls occurred when the person is actually alone, either at home or outside, for example. So that's often an important thing to consider, for example. 80% of those who've fallen were unable to get up after at least one fall, for example, as well. So again, that's a challenge that, many of the times people can actually get up, but again, that there are people who are sometimes unable to get up. And of those 30% of folks who had fallen when they were alone, for example, they laid on the floor for at least an hour or more, for example. So again, these are some of the realities of falling that can actually occur. And I think it's important to recognize that as well. So in studies that have actually looked at some of these personal emergency response systems, for example, they found that, what are the benefits potentially to consider? Well, sometimes these personal emergency response systems will not prevent people from actually falling, for example, but where they can be useful is they can help people gain faster assistance in an emergency and preventing additional complications. They can extend the time users are able to remain living at home. They can actually increase a user's sense of security. So often when you actually ask groups that run these services, kind of what are the most frequent types of calls they get, 90% of the time, it's actually people checking to see that their devices are working and just wanting to check in to make sure they're working. And so often people like that sense of security that they have, knowing that if they need help, they can always get it that way. And it often can reduce anxiety about falling and increasing one's confidence in performing everyday activities as a way to manage unpredictability. And sometimes it reduces the anxiety for the person themselves who are living at home, but often it can reduce anxiety for other loved ones and friends as well, who have a bit of greater sense of security and are less worrisome about their loved ones because they at least feel that there is a way that their loved one can get help, should they need it that way. So as I mentioned, there are many different, you'll see ads all over the place for different options, for example. So these are just four of the most common popular ones that are available. And again, some people, will say, Dr. Sinha, I'm interested in this, but, I heard that these are very expensive. So yes, there is a cost. Sometimes, depending on places you live in Canada, there are some government programs that might actually pay for these things. So I know in BC, or sometimes community programs actually have funding where they can give this service to an older person for free, for example. But most often people actually, these aren't things that are covered under public health insurance plans. So these are things that people have to pay out of pocket for. But again, I just want to show you, these are the 4 most common ones available across Canada. And they can start as low as $15 a month, for example. And so again, it's also thinking about less than $1, around $1 a day, for example, can sometimes be an opportunity to consider, is that worth kind of reassurance as well? So again, just some options that are available. So we know that Canadians are more determined to age in place than ever before. And the pandemic itself, as I mentioned earlier, has led to about 60% of Canadians to change their opinions about the possibility of living in a long-term care retirement home, and amplifying the need for home-based supports to enable aging in place. So I think it's always important to, to think about this because people are often thinking about these issues. But again, how do we actually, how do we enable people to think about more of these opportunities as well? And so for my healthcare provider colleagues who are watching today, they say like, okay, so well, how do we start enabling these conversations? And I basically say, talk about it, right? Take that extra time. So I usually use that prompt as asking my patients, for example, especially if they told me if they've had 1 or more falls in the last 6 months, I always ask, what's happened over the last 6 months or the last year since I last saw you? Any emergencies? Have you been to the emergency department? Have you been to hospital? Have you had a fall, for example? I often bring these things up because, again, often we have to appreciate that the number one fear that older adults actually hold is not a fear of spiders, it's a fear of falling. And especially when people are living on their own, or they may have been experiencing falls or have these health issues, it's just really important to ask people, have you thought about what you would do in the event of an emergency? And by providing that advice and letting people know there are different things out there, there are different options, just like what I've discussed earlier, I think it can really help people, do their own research, figure out what might make sense for them, and on how to live more safely on their own, but often making sure that they know that there are options to look at as well. And so some of the things that I often kind of do as a physician to kind of support people to explore how they can better age in place is really thinking about that assess and prevention. Often I'm seeing people in my office. I do have the privilege of doing house calls in Toronto with the house calls program. And when I do that, it's my opportunity to actually get into a person's home or ask them. And often what I often recommend is an OT home safety assessment. So these are things that can often be provided free of charge through publicly funded home care programs, where a physician provider or a nurse practitioner or others can often make a referral to the home care service. Often many home care programs can allow you to give them a call directly, and you can ask for an occupational therapist who will actually come to your home and can actually take a look around the home and actually identify things that would put you at increased risk of falling or other hazards. They look at your bathroom, they look at the equipment you have. They might suggest a grab bar, for example, or an extra railing, for example, or securing loose rugs that you might have around the floor. I've had the privilege of working with a number of OTs and seeing the OT magic, they like to call it, that they can do in a home. And again, an ounce of prevention is worth a pound of cure type thing. So that's one thing that one can do. Often when people talk about aging in place, I often remind them that statement, move it or lose it. So staying active. And when we look at the exercise guidelines for Canadians in general and older Canadians as well, we know that staying physically active, getting about 150 minutes of exercise a week, is really all you need to help strengthen your muscles, increase your stability, improve your mood, prevent dementia, and maintain one's overall health. And so people say, well, how do I do it? What sort of exercise should I be doing? I always say the exercise you're most likely to do. So if that's a big walk, once a week, great. If it should never be less than 10 minutes of kind of something that gets you huffing and puffing, if you will. So it could be 20 minutes a day, or whatever the average works out to 150 minutes a week. But 5 times a week, 30 minutes, that'll get it for you. Might be one big, kind of big exercise on the weekend. But again, getting 150 minutes of exercise a week, whatever you want to do, is really important. Staying connected. So again, we talked a little bit about using digital supports and services that can keep one connected to loved ones and their community and more safe. And we talked a little bit about some of the different devices like smartphones, like personal emergency response systems, smartwatches, or other devices that you might find helpful, that help you stay connected and feeling safe. And I think finally, open communication. So I always say it's really important to always have that open communication with my patients, with families and loved ones, to feel comfortable and confident about enabling people's aging in place solutions, even after some solutions are implemented, and as one's health evolves. So I know certainly I do have some patients who are not keen to use a walker or a cane because they feel it makes them look old. And I remind them what my mentor at Hopkins always taught me, and would always say to all my patients, and say that, remember that vanity or pride is a sin. And eventually people will say, you know what, maybe I should get that walker or that cane, or maybe I should look into that device. How do I make a referral? So I always keep an open line of communication, because again, sometimes people think not the right time for me, but sometimes when it becomes the right time, be sure that you feel that you can ask a healthcare provider or a community expert, or your family member or friend, to do some research and help you figure out what the right solution is for you at that time. And be open to asking, and be open to providing that advice to loved ones and friends as well. So my bottom lines are really that aging in place is a top priority for every older Canadian, though they are at increased risk for experiencing injuries, medical and other emergencies that may threaten that. So while everybody is really keen to age in place, we know that injuries and emergencies can often threaten that. But I think it's really important to know that older adults and caregivers can often benefit from a number of cost-effective at-home technology solutions that can help people stay connected and maintain their independence. But most people aren't having discussions with their regular healthcare professionals or others to learn about them and to prepare themselves. So I think it's really important to kind of make sure that you've been exposed to a few things, things that I think are pretty cost effective and reasonable. But again, it's good to know what's actually out there and what makes sense. And I think armed with better knowledge and awareness of aging in place enablers, as I like to call them, healthcare professionals like myself and my colleagues can better engage their patients and their families about possible tactics and technologies to support aging with greater independence and peace of mind. So with that, I will open it up to questions and go from there. So I'm going to end my slideshow right now. And I'm going to look, we've got a bunch of questions, it looks like, in the Q&A. And then we also have a lot going on in the chat there. So I am going to just, so what I'm going to do is I'm going to start working through all these questions that we have open. So we have 18 open questions, so I'm going to start going through there. And if you want to try and beat the clock and throw another question in, go into the Q&A button and we'll go from there. So the first question I see is saying, do I need a referral from my family doctor to see doctors in the geriatric team? So yes, what we basically require is that if someone wants to see, for example, a geriatrician or a geriatric psychiatrist, so geriatricians are consultants, they're specialist physicians. They're not necessarily they're not primary care providers in Canada. In the United States, they are primary care providers. But here we need a referral from another physician or nurse practitioner in order to be seen. And we often work in partnership with people's primary care providers. So often primary care providers have a lot of good knowledge around caring for older adults. But if they have specific things that they'd like the input of a geriatrician on, often we can provide a consultation and provide a follow-up or two to help people get the advice and support they need to work better with their family doctors. So that's that one. Roberta asks, what about those who have been physically disabled? So I think there's an example of CP, which I believe Roberta's referring to as cerebral palsy, for their whole lives, but are now in decline. What resources can be found? Roberta, that's an excellent question, right? Because we know that we're talking about issues that might be more prone to older people, but we can also think about younger people or people of all ages who might be living with disabilities or other things that can threaten their ability to live independently at home. So I think a lot of what I've talked about, again, can be applicable for younger populations. Again, everything from accessing OT home safety assessments, home care services, and other initiatives like falls and exercise prevention programs, and some of those smart technologies that I talked about. These are things that can actually be applicable to people of all ages. But sometimes it may make sense to kind of look at services that might be a bit more geared towards older people, depending on where you live, because that might, again, be things that might be more practical, but maybe more commonly delivered towards older people. There's a question here saying, are there specific exercises that can prevent a broken hip when a fall occurs, for example? So again, the two most common forms of exercises that we talk about are exercises that strengthen people's gait and balance. So your gait is, your gait and balance and strength. So when we talk about people's balance, for example, we're saying how steady they can actually be. And sometimes if you have various forms of weakness or other things, for example, then this is, and core strength issues, for example, these are things that, again, a physiotherapist and occupational therapist can recommend specific exercises. And if you live in Ontario, for example, there are 2,000 free exercise and falls prevention classes that are occurring. There are many that are now operating online as well. And these are specific exercises that work on improving both your strength, so your ability, for example, for me, to stand up and get out of my chair. So basically without using my arms, for example, so building that strength of those big muscles, like in your glutes or in your quadriceps, for example, that help you stand up independently without having to use your arms, but also balance exercises. Sometimes there are exercises that can be done that improve your balance and then keep you more steady on your feet. So it's often if you're thinking about exercise programs, or if you're working with a physiotherapist, you might say, I've had a fall, and are there exercises specifically that can prevent me from falling, such as strength and balance exercises? And they'll know exactly what you're talking about and the types of exercises that might be good for you. Okay. Nenki asks the question, would it be beneficial for older people to sit with a full spectrum light every morning, regardless of seasonal affective disorder or not? So interesting question. I don't know the evidence around that. I know certainly that people who do suffer from seasonal affective disorder would benefit from light therapy. I don't know the evidence right now about light therapy for everybody in general. So I can't really say that I've heard that that's a recommendation that everybody should be doing, but I don't know the full literature on that. But certainly for people who do have the condition seasonal affective disorder, that can be a very effective therapy for some people as well. Okay. The next question is, I'm currently looking for a very simple cell phone for my 96-year-old father. He lives independently in a retirement home, but needs the phone for emergencies. Long story. The current smartphones are a bit overwhelming for him. I am having a hard time locating something very simple that would feel more familiar, like his old cell phone. Any guidance? Marianne, that's a really good question. So I am not a cell phone expert. I still have my iPhone 6 SE. That's about X number of years old. So again, I think people sometimes like the Apple, the iPhones, because they find them pretty simple. But you know what I would do is I would certainly go to a cell phone shop and let them know that you're like, what are the things that might be easier to use. And there might be folks who can actually put some ideas in the chat about certain brands or ideas out there. I can't necessarily, there's not one that I've known as the seniors phone or a phone that works really well for older people. But again, if your 96-year-old father, for example, has visual impairments, has other things, maybe a bigger phone with a bigger a frame might be easier to use, for example, easy to see buttons, for example, other things to do. So I'm going to look to colleagues in the chat to maybe give some ideas on that one. How accurate are these smart watches? They're actually, Mike, that's a great question. So I certainly know that with the Apple Watch, for example, they have done a lot of work, testing the accuracy of these things out, and they're actually pretty darn accurate in terms of how well they can do. So they've done a lot of testing of these things over the years to kind of look at that. That's for the falls detection technology. I know Apple does it. I don't know if other smartwatch providers have created those technologies as well. But certainly these are some of but they're pretty accurate from what I've seen. But I wouldn't say that they're 100% accurate. But I think they're pretty darn accurate overall, for example. So which panic button device linked to an emergency health system would you recommend? So again, it really depends on kind of what you're looking for. So for some folks, for example, if it's price is the issue, I showed you a chart there. Right now, TELUS Health is offering, I think, the cheapest kind of solution that's available out there. So if price is an issue, that might be where you go for. And for most of my patients, price is the biggest issue. So I think that's kind of the easiest kind of determination factor. But again, it might also be availability. What's available in where you live, for example. So some service providers that I showed in that slide might be available in your area. So it might be good to figure out what's available and what the costs are. But generally, I think they all work pretty well. I haven't heard that one doesn't work as well as the other. But certainly most people make the determination based on price and how it works. So that's the best advice I can give on that one. Okay, I'm trying to race through. Someone said, Denise says, does that offer include data? I think you're talking about maybe what I pointed out, that TELUS is that plan for low-income seniors. So that's the $25 a month. You get the free smartphone. You get the calling, I think, and on that little thing, it said 3 gigabytes of data. So it's up to 3 gigabytes of data, which my current phone has 4 gigabytes and I do fine with. So I think as long as people are just making phone calls and doing the basics, that does include data for sure. But certainly always, figure out, ask these important questions before you sign up with things, so you know exactly what you're getting for what you're paying. Okay. Anonymous says, it has been a while since I looked, but have you heard of stoves with automatic shutoffs after a certain amount of time, i.e. to prevent fires if the individual is heating food up to but forgets to turn off the stove or becomes incapacitated? That I do not know. So I believe that, again, I have appliances that are mighty old and still work fine, but they're old fashioned. So I think certainly, our occupational therapy colleagues, when they do a OT home safety assessment, they sometimes have information on some of the latest devices, but you can certainly talk to an appliance dealer to find out if any of the new appliances out there have these special features, for example. I don't know the answer to that, but I certainly know that sometimes what our occupational therapists will do is when they are working with patients who have dementia, who have problems with stoves and those sorts of things, they sometimes will turn off the stove from the back so that a person might play with the knobs but can't actually cook with it, or in a more controlled way. So, but it's a great question. I don't know about the latest in terms of stove technology. What is the threshold to define low-income senior to access the TELUS phone, and do documents approved need to be sent? I do not know that question. So Nicole, it's a great great opportunity. I would just give them a call and let them know you're looking for that low-income seniors phone plan and what information is required. So, but I think they would have that information, that they could give that information to you. But I believe it's basically if you're receiving the guaranteed income supplement, which is basically a special supplement for low-income seniors, then I believe you basically qualify. It wasn't a really difficult process. I think basically about 2.5 million seniors, if I remember correctly, qualify for this plan. So I was pretty happy with when they came out with this opportunity. There we go. Okay. How are we doing? We have 1 minute left here. Does the Seniors TELUS initiative include internet connection in the 25-month fee? Okay, I think it's just basically what you get with a phone. So it would be data, and it would be calling in that way. So I don't know if that answers what you mean about the internet connection fee, but I would certainly give them a call if you're interested in looking at that to figure out if that includes what you mean. But I think it basically includes data, and that it's, again, a really good opportunity. Okay. Is this a presentation available in French? Je parle un peu de français, but we don't have this presentation yet in French, but it's a great suggestion, Lorraine, because I think we should probably look at doing it in French as well. So I will, so that's a great opportunity to consider that opportunity further. Again, lots of questions about TELUS refurbished phones, which is great. Have internet capability. Yes, they do, because they have data. So that's the answer. They can connect to the internet in that price. Someone said, can you mention what is telesitting? I do not know, Maria, what telesitting is. So please send us a bit more around that question and we can try and answer that. And then how can we learn about how to access various services, example, OT home safety assessments in different provinces like Manitoba? That's from Marcia. Marcia, again, I would call your local home care service. So every province territory has a local home care authority. I would give them a call and ask them about OT home safety assessments and if you would qualify for one and how to best access that. But pretty much that's a service available for free in pretty much every province and territory as I'm aware right now. Okay, and I think I've gotten through a ton of questions, and there are certainly more that are coming in. So I'm going to have to cut it there. But my goodness, thank you so much for everyone's participation, and we will certainly we'll copy these questions, we'll copy the chat. And certainly it'll give us some more information on further things we can try and answer again in future. So thank you so much again, everyone, for joining us today, and we will end the presentation there. So thank you.